Alright. Hello, my YouTubers. Today I will be studying another defect, which is, well, we're studying our very first defect because we studied earlier just a normal anatomy. So right now, I got myself a bunch of markers too, just so I can draw it better and explain it better. Alright, get one of each color. So, this is the absent pulmonary valve. Okay, absent pulmonary valve. So we knew from last time that the pulmonary valve is the one that connects from the right atrium. I draw it like this, and the aorta. I mean the atrium. So the right atrium, right ventricle, left ventricle, left ventricle. So the pulmonary valve is the valve right before it goes to the lungs, the pulmonary artery, and goes to the lungs. So this is our deoxygenated blood coming from the superior vena cava, from the inferior vena cava, from the coronary veins, and it goes to the right atrium, all the way down to the right ventricle. From the right ventricle, it shoots up to the pulmonary arteries. This little valve here is the pulmonary valve, right here. That's where our pulmonary valve is. Pulmonary valve is a 3-leaflet valve. So the thing with pulmonary valve that I found interesting, and I still can't find a rationale behind it, is that with absent pulmonary valve, you get systemic desaturation, dilated pulmonary arteries. So this part here dilates. And since it dilates, the heart sits right in front of our trachea, our bronchioles, our lungs, the respiratory part of the heart, so of the body, respiratory part of the body. So with that, if for example, let's see, this is the trachea, and then you get your bronchial here, right there. If this pulmonary artery enlarges, it gets bigger even in the back. What it does is it compresses, it pushes back the bronchiole and causes compressed bronchioles. So if you don't have a pulmonary valve here, if it's open, you get compressed bronchioles. Usually this defect comes together with a VSD, which is our ventricular septal defect, and the valve, like we said, is absent or insufficient. Let me see if I missed anything. So if it's compressed, we get either a abnormal development of the ventilatory tree, because we know these are kids and they are developing And if that is, if there's something wrong here, then it wouldn't form right. Marked rest. So nursing wise signs and symptoms that we watch out for here is respiratory, impairment, because we are not getting the air in because of this part compressing and hindering the actual air to go in during our inhalation. So what we get is a systemic desaturation as well. So you will see our O2 saturation be low. Instead of greater than 92 or greater than 94, it's going to be lower. I'm not sure the exact number of how low it gets. Maybe it depends on the severity of the compression. Also, in the presence of a ventricular septal defect, because like we said, sometimes occurs with a ventricular septal defect. That means this is open. So there is a shunting of blood from higher pressure to lower pressure. Right to left shunting can occur leading to systemic desaturation, which may be associated with absorption. Okay. So on top of this airway obstruction that's causing the low saturation, another reason for oxygen desaturation is when our blood shunts from where's that? I read it. Right to left shunting. Right to left. Why would it go to the left? Left is supposed to be higher pressure. Because in infants, the lungs have a higher resistance. And the blood goes from lesser resistance. So if the lungs have higher resistance, this is high resistance, this all the way here is high resistance. So instead of the blood going up here, it would rather just go to the left ventricle. And you know this is the deoxygenated blood coming from our body. And instead of going to the lungs to get it oxygenated, it goes straight to the left ventricle and to our systemic circulation, which is our body here. Right? So that causes oxygen desaturation. The compression causes oxygen desaturation. Yeah. So therapy with this is pulmonary replacement, pulmonary valve replacement. This is our treatments. Pulmonary valve replacement, VSD closure. So they replace this valve here to make it a functioning valve so that our blood flow is not impaired. They close the VSD. When we close that, we won't have shunting. So no deoxygenated blood is going to pump to the systemic circulation from the right ventricle. We also have plication of pulmonary arteries. What is plication? Plication of pulmonary arteries. Plication. I'm gonna Google that because I do not know what plication is in pulmonary arteries. But that is what absent pulmonary valve is, right? So we don't have our pulmonary valve. It often occurs with a VSD, which is a ventricular septal defect. Also, what was interesting, now that I'm working at my unit, I realized that VSD does not does not always mean like there's a big hole in the myocardium of the right ventricle and the left ventricle. Sometimes this big hole is not just one big hole. It could be like Swiss cheese, where there's multiple holes in that part of the myocardium. So that's interesting for me. Like, I thought it was just one hole all the time. Or sometimes I think when they say multiple VSDs, that means that there's, well, probably means the cheese hole too, but there's more holes on the ventricle septum, so it could just go like that instead of having one big hole that all the blood goes to. So just an interesting fact. So VSD, no pulmonary valve or insufficient pulmonary valve, causes our pulmonary arteries to dilate for some reason. I still cannot think of the rationale. I wonder why. If y'all know, if any of you can figure it out, let me know so I can understand it better or remember it better, because I always remember it better if I could explain the reason why. So the dilation of the pulmonary artery pushes on our bronchiole and compresses it. Compressing our bronchioles hinders airway from going down our respiratory tree, causing respiratory impairment and oxygen desaturation. Another thing with a ventricular septal defect, deoxygenated blood shunts from right to left. The reason being higher resistance in the lungs from our babies is causing the resistance of the blood to go to the pulmonary valve, to the lungs. So instead, it would just choose to go straight to the left ventricle. And to the left ventricle. So the desaturated blood from our body does not get oxygenated in the lungs, and it just goes straight out to our body circulation. So that's another reason that we have O2 saturation is low. So nursing wise, we want to monitor their respiratory status, if they're having increased work of breathing, shortness of breath. Oxygen saturation would be low because of those two reasons that we just discussed. Treatment wise for this is a pulmonary valve replacement, so surgery, they change the whole pulmonary valve. They also might do VSD closure, another surgery, and plication of the pulmonary artery, which I said I do not know the plication. I wish I could Google it, but my phone is the thing that I'm using to record. Let me get something to Google it. Where's the iPad? Oh, sorry guys, I'm not prepared. I just decided to shoot this straight from going to the gym. So let's see what plication is. You can probably fast forward this when you're watching because it might take me a while. Plication definition. I don't even know if I'm saying it right. Plication. A fold or being folded. Plication of pulmonary artery. Alright, it says here absent pulmonary valve. It's not gonna. Another reason why it's shunting right to left is because this part here is smaller pulmonary artery is smaller, so it's harder for the blood to get in. So instead it goes to the right, to the left ventricle. This is smaller without the valve. Okay. I still haven't researched what plication is. Plication. Surgery. Oh, well, it's a procedure making large folds, thereby making it smaller. So I think what they do is, since pulmonary artery plication, to alleviate this respiratory impairment caused by the compressed bronchioles, they make this smaller through surgery, what they call plication of the pulmonary artery, which is folding. So that's what I found out from